given the weather. Yeah, definitely.
In person. It sounded like Bruce squeezing us in, and I was so glad.
Yeah, my other meeting, I was like,
It's painful.
Did you see how
is it-
I did?
was it-
Right, absolutely.
I'm very glad to see.
Later, we meet in person. Did you see Joyce for a little bit?
Yeah.
For a little bit away. Actually, if I could have been
Right.
level, with other meeting. My no, I think it'll be a great. Yeah.
Honestly, so sour. Yeah, coffee.
I just got download on the, I missed the fact that I was away.
You know,
I
so I need to play it. Oh, yeah, there's a kitchen straight back.
Because everything real time. We're planning her sort of gentler flow when it didn't happen. So.
Yeah, right.
I think he was well aware. It was nothing.
Yeah, right.
Even though there was some good style of harmonization, whatever it was, that's visual.
But rebuilding a meetings.
Yeah, no, I
Yeah,
know.
I didn't send Mike a note just to say, if I could be helpful. on that meeting.
Great.
I'm actually, and I'm leaving tomorrow. I'm actually going to Ukraine tomorrow
Oh, wow.
from London, and then, so I'll be back the week 20th.
Okay. All right.
Yeah, right.
Okay. Yeah, just.
Good night.
So I think we'll go ahead and get started. Welcome to all of you here in the room and to those of you online. We're really excited today to have Halyna Skipalska, who is the HealthRight Country Director in Ukraine, with us to talk to all of us, educate all of us about her experience thus far in conflict-affected Ukraine, give us some important insights, particularly related to healthcare and access to mental health services, which we're is very involved in the country. And then, so I think Halyna is going to make a few opening remarks today and talk about this notion of resilience, building resilience in Ukraine. I will sort of probe with her. We're going to do a Q&A afterwards, and some of the questions that I have for her are about how can we, those of us who are outside Ukraine, support Ukraine in building up their resilience to sort of endure the conflict and hopefully quickly recover from the conflict when hopefully it ends in the not too distant future that we'll see. And then we'll open it up, I think, for questions, both from those of you who are online and those of you who are in the room. So with that, I would like to turn the podium over to my colleague and our fearless leader in Ukraine, Halyna Skipalska. Thanks for being here.
Thank you, Peter, for this introduction. Dear colleagues and guests, my name is Halyna Skipalska, as Peter introduced me, and I am HealthRight International Country Director in Ukraine and Executive Director of the Ukrainian Foundation for Public Health, local NGO funded by HealthRight. For more than 20 years, I have been trying to make this world better, to make Ukraine the better country where human rights are meaningful and ensured, where the right to health is transformed into longer and happier lives. And I would like to say that all these efforts, as well as the work of hundreds of my colleagues in Ukraine from various sectors of public health, have been wasted and ruined by the will of a dictator, and regrettably millions of Russians who support his autocratic regime and brutal war which we have in Ukraine. We do not refer to calendar dates in Ukraine anymore. We count the days of the war, and today is the 378th day of the Russian invasion in Ukraine. 2 weeks ago, we marked 1 year since the Russia war started in Ukraine. Let's have a look at some of the numbers that show the scale of the devastation, including the cost of the war in human rights. Here we included some numbers. For example, according to the latest UN Human Rights Office data, more than 13,000 civilians have been confirmed injured, with 8,000 civilians killed since February 24, 2022. And I would like to say that the truer numbers are likely to be substantially higher. In many areas of military operations or occupied territories, victim identification has been difficult, if not impossible. Sadly, the war has an impact also on children. 487 children have been reported killed and 929 injured, and at least 10,060 children have been taken to camps and other facilities in Russia and Russian temporary occupied territories, prevented from communicating with their families, parents, and subjected to pro-Russian re-education. It's really very, very sad, I would say. The actually total amount of damage caused to Ukrainian infrastructure, residential and industrial buildings, schools, healthcare facilities, energy and utility infrastructure was also very high. In previous slide, we included this number, $138 billion. Here, I would like to show you one video illustrating Ukraine's resilience and why we continue to fight.
Ukraine holds its lines and will never surrender.
Don't forget, everybody.
So it's very powerful video. When we identified, when we discussed with our team in Ukraine which video to choose, we cried. You know, every time when we watch this video, they touch our hearts. So I believe that strength and bravery of Ukrainians are the answer to the question why we continue to fight. And of course, civil society and the volunteer movements that are defending the war's other front and are quick, flexible, networked, and efficient in closing gaps and addressing current challenges we have in Ukraine. It should be also mentioned that as we celebrate today International Women's Day, that women volunteers and also women-led civil society organizations are at the forefront of community-level response to the war in Ukraine, including for the rapid provision of humanitarian assistance and services, particularly in rural areas. So then I have a few slides about most pressing health and social issues that Ukrainian people are facing today. Since the Second World War, the world has not seen such as an unprecedented displacement of people. The vast majority of people who fled their country have been separated from family members, most often due to the Ukraine's restriction on men of fighting age leaving the country. More than 8 million Ukrainians have fled their country and become refugees across Europe, according again to UN data. 7.1 million others were internally displaced within Ukraine in 2022. And the largest group of refugees, of course, are women, followed by children and also elderly people. After Russia's invasion in 2022, the humanitarian situation in Ukraine deteriorated drastically and rapidly. The number of people in need of humanitarian aid and protection increased from approximately 3 million people at the start of 2022 to 17.7 million in 2023. And 7.1 million children are in need of humanitarian response. In addition, from October 2022 to January this year, Ukrainians faced an energy crisis. You probably heard about it, as Russia destroyed 50% of Ukrainians' energy infrastructure through different missile attacks. The crisis disseminated essential services, including energy. I remember December previous year 2022, where we had power cuts for 16 and 20 hours per day. Water supply and heating during the cold winter season when the temperature falls below zero in Ukraine. Also, another UN data show the scale of humanitarian crisis in Ukraine in 2022. You can see that there are more than 11 million needed support with emergency shelters and also essential household items. 9.3 million need food and livelihood assistance. 5 million are in need of educational support due to massive destruction of schools and also displacement, internet and electricity disruptions, and lack of devices and equipment among teachers and school children for example, online learning. The ongoing war has immediate and long-term effects on the health of Ukrainians. Estimated 14.5 million people in Ukraine need, for example, health assistance. A risk of cardiovascular and communicable diseases increases as many people were on the move, lived in collective centers, in shared rooms, and in poor sanitary conditions, had restricted access to healthcare, and etc. Also, millions of children are at risk of missing their routine vaccination, increase of vaccine-preventable disease in the future. Because of the war, at least 9.6 million people in Ukraine may have mental health conditions, and an estimated 15 million to be in the need of psychosocial and psychological support. The war also has caused massive destruction of health facilities, forced the displacement of health workers, Ukrainian health workers, and decimated access to healthcare in the worst affected by intense hostilities areas. According to WHO data, over 700 healthcare facilities were already totally damaged. Almost half of the facilities in east and south of Ukraine, in regions like Donetsk, Zaporizhia, Mykolaiv, Kharkiv, Kherson, are reportedly either partially or completely not functional. And the people who stayed behind, for example, the elderly, persons with low mobility, those with physical disabilities, have complex needs that the health system is struggling to meet under the current circumstances. The war has broken, hampered, or disrupted also medical supply chains. Those people with diabetes, those on hemodialysis, and certain groups of cancer patients were put at direct and immediate risk of healthcare deterioration or even death. The power cuts left hundreds of hospitals unable to provide even the most basic services, like vaccines and temperature-sensitive medicines could not be kept cold. Critical equipment like ventilators and defibrillators couldn't function in such conditions. And even basic emergency obstetric care could not be performed safely. About sexual violence and risk of gender-based violence, including conflict-related sexual violence. All these issues increased at a rapid rate in 2022. Also, vulnerabilities and risks to exploitation, trafficking and violence, particularly for internally displaced women and children, those in collective centers, returnees to retaken areas, women and girls with disabilities and other vulnerable and at-risk populations increased. Some 3.7 million people in Ukraine were estimated to need services to prevent gender-based violence or supporting survivors in 2022. Now, I would like to speak about a little bit more positive things, and I would like to share with you some highlights from our HealthRight International work in Ukraine that addresses the immediate needs of Ukrainians displaced and affected by the war, and also helped to improve their coping ability and well-being last year. So we coordinated our efforts with many other humanitarian organizations, UN agencies, international organizations. We launched new projects targeted internally displaced people and gender-based violence, sexual violence survivors with financial support from UNICEF, UN Women, Women, Peace and Humanitarian Fund, USAID, BHA, FHI, World Vision International, and Action Aid. All these are our great donors and partners. Another focus is a high-level also national coordination and collaboration. In the 2022, HealthRight engaged in high-level meetings with representatives of Office of First Lady of Ukraine, Mrs. Zelenska, WHO in Ukraine, also MHPSS Technical Working Group in Ukraine, and different other civil society organizations. Along with other partners and stakeholders, HealthRight also contributed to the development of a mental health framework to address the growing MHPSS needs of the Ukrainian population in the context of war in Ukraine. Also, we have a long-standing collaboration with the ministries, Ministry of Social Policy, Ministry of Health of Ukraine, to pilot and scale new models and approaches in public health and protection. HealthRight programs are implemented in partnership also with local communities, local governments, municipalities, other community-based organizations. And I would like also to mention that we are very much interested and conduct academic research in partnership with national and international universities. Only in 2022, we started developing few proposals focused on partnership with New York University. We are very grateful for this partnership. We think about adaptation and piloting of self-help plus called SH plus intervention to help to reduce and prevent psychological distress among internally displaced people in Ukraine. Also, we, with NYU team of professors, prepared recommendations for gender-based violence prevention and treatment for internally displaced women who survived violence. Here, I would like to list the main services which we launched and we still continue to support in Ukraine. We run 78 crisis mobile teams in 18 regions of Ukraine. Actually, with mobile team services, we cover all Ukraine. We also just launched 9 gender-based violence response and care units in eastern and southern Ukraine in primary healthcare facilities. We also run 6-day centers like safe spaces for women with children and 3 halfway houses, shelters in Kyiv, Lviv, and Uzhgorod. That previous year, we launched 4 Barnahus centers for children who are survivors of violence, who are survivors of sexual violence and crimes in cities of Ukraine. And also we have 2 online platforms, or actually 3 online platforms to support war survivors, gender-based violence survivors, and also adolescents. And few words about these 2 platforms through which we provide services for women survivors of gender-based violence, sexual violence, and also for those who are affected by war. Through these 2 platforms, one is called Safe Women Hub and another is called Brave and Safe. GBV survivors, sexual violence survivors, and women at risk of violence have access to immediate and comprehensive assistance, from psychiatric counseling to managing traumatic cases, follow-up support, and also social and legal support and referrals. Platforms operate through pages in social media where we are quite active, like Facebook, Instagram, Telegram channels. They can be easily accessed via smartphone or tablet. That is critical in case of emergencies for women and girls from, for example, even temporary occupied territories on the move to a safe place, who live in collective centers and camps, or even in Europe. We have also 7% of clients who call to our platforms from Europe. Also, HealthRight have been providing humanitarian support, actually a lot of humanitarian support. We assisted people during the evacuation, and it was from the first day of war start. We worked at departure points, helped to find a shelter or temporary accommodation for many of them, provided first mental health aid in bomb shelters, and disrupted food, medical, and hygiene kits to meet the basic needs of war-affected populations and people. There are a few major achievements of HealthRight in 2022. We launched immediately. I remember the day when Peter called to me and we launched Ukraine Emergency Fund, which as for today accumulated about $500,000, and it's great. It's really huge support for Ukraine. In 2022, we provided almost 2.4 million services to more than 400,000 war-affected people, mainly women with children. We have increased actually the number of specialists employed through our projects and organization by 5 times. By growing from 116 staff in March 2022 to 569 in February 2023. We also expanded and scaled our services to address emerging challenges like mentioned by me, mobile teams, day center, halfway houses, Barnahuses, and also created new ones like platforms, online platforms. Other achievements that should be also highlighted, and I would like to emphasize wide geographic presence across Ukraine, including temporary occupied territories, deliberated areas, and military operation areas and abroad, like Europe. Integration of essential survivors care into the pre-existing primary healthcare facilities and protection access points, like IDP reception centers, shelters, day centers, healthcare facilities, and etc. And we are unique in this because many international organizations, they launch some services separately from state partners and with no specific focus on health. Mobility and accessibility of services is also one of our strengths, and capacity building component for community-based healthcare workers and also other service providers. And here I would like to show you the picture, and I know that you also can see this picture on one of the banners next to this room. This is a picture of our frontline workers conducting an outreach visit to identify people in need. And this picture was taken by the photographer Max Levin, who was killed by the Russian military in the last days of March 2022 during, it seems to me, in Bucha, yes. Many of our staff were forced to flee their homes, and some of them also lost loved ones, houses, and other belongings. Many have already returned to their homes, but we believe in our victory. Together with our partners, we are dedicated to working every day to minimize the war's impact on the most vulnerable populations in our country. To encourage the world to stand with Ukraine, HealthRight International has recently launched the campaign, Don't Give Up Ukraine. I also would like you to follow this hashtag, to use it. We invite you to use it to follow, for example, news and joint activities with this campaign. And our goal is to inform as many as possible people about the continuing war in Ukraine and resulting social challenges, to highlight the efforts of civil society actors who find practical solutions to these challenges. Thank you very much.
All right, thanks, Halyna.
There you go. Should be here, but it's
Yeah.
fine. Okay.
Light in your face.
Yes. No, it's fine.
So thanks for that summary of the work. You know, as I think back, so HealthRight has worked in Ukraine since 2005,
Yes.
right? And the work, like the rest of HealthRight's work, has historically been focused on capacity building and health system strengthening, really with a view towards, you know, sustainable health system improvements. That's always been sort of the mission and the focus of the work. Maybe you could say a few words about what that shift was like, moving from a development sort of framework focused on capacity building and health system strengthening to a humanitarian response. They're quite different, and I think it'd be really interesting to hear about your experience in leading the team in Ukraine. You talked about a few dimensions of this: rapid growth. For one, we went from a little over 100 employees to 569 today. Lots more projects. Tell us a little bit about that shift from sort of the development framework to the humanitarian response.
Yeah, so thank you. Yes, we really used to work in Ukraine with in order to achieve mission and to focus on development issues, and we tried to be prepared for war start, but it started unexpectedly. So we had some procedures. I remember at the end of January 2022, we conducted like safety and security some short workshop for our staff of mobile teams who operated in Donetsk and Lugansk regions, but we were not prepared to this war. And I would say that there were different periods. So end of February, we understood that it will take we thought that it will take 1 week, maybe 2 weeks, really to give staff possibility to find safe place. We helped to our staff to be evacuated. We helped our clients to move to more safe places to west of Ukraine or even to Europe. And then we in places where we arrived, we saw we observed huge humanitarian needs, and we understood that it's time for us to start humanitarian work. And this type of work actually was new for our staff, because staff was focused on some specialized, so they provided some specialized services. For example, psychologists who were trained by us for years on issues and traumas related to gender-based violence. In the Donetsk region, they stayed in some bomb shelters, informal bomb shelters, like some basements in their cities, and helped other people who just came occasionally to that bomb shelter at that day, that time, to cope with some traumas, to find some resources to move, for example, to understand that this is the start of war, that they have to take some decisions, and etc. So, but humanitarian work really differs from what we already done in Ukraine, but it took 1 month. I think that April, yes, in April we launched office in Lviv. We started to rent a warehouse, hired some drivers and people who also were ready to help with logistics, and hired first psychologists and social workers who started providing psychosocial assistance to internally displaced people in different places, like railway stations, on the border with Poland, on the border with Romania and Hungary. So it was not easy, but maybe I would say that we didn't have time to analyze what we are doing. We just understand, here are our people, we have resources, we just need to do something and to react, and this was like a recipe. Now it's another period. I would say we can conduct trainings, how to organize logistic issues, how to bring humanitarian aid to different places, depending on security situation, because it's very different to bring humanitarian aid and provide services, for example, in places close to east and south to active hostilities, and to work in west of Ukraine, where we have a number of IDP camps and provide services there. Yes. So,
do you mind if we move the chairs forward more so the light's not in your face?
That'd be good.
See how that feels for you.
Better.
yes,
Yeah.
better, but it's about us now. We can work in different conditions. In March, when we moved with family to apartment of our friends, my one son had some online classes in one room, small room. Husband worked in another room. Another son used another room. And I only had kitchen. So all my calls with UNICEF and with UN Women, I conducted from kitchen. So we can really work in different conditions. It can be light.
I think one of the things that I think probably a lot of people wonder about in a complex humanitarian emergency like this is the aspect of multi-sectoral coordination. You talked about the range of players that we collaborate with, from local civil society and local government to the Ministry of Health, the Ministry of Social Policy, and then international actors like UN agencies, UNICEF, UNFPA, WHO, and then big multinational NGOs like FHI 360 and World Vision, et cetera. How, maybe give people a little bit of an insight into how that coordination happens. What does that look like from your perspective on the ground, that sort of collaboration and coordination? How does all of these initiatives in the health space, how are they coordinated?
Peter, it's a good question, but I want to be honest with those who hear me. So coordination was a weakness all time in Ukraine. So it was not our strength to do coordination. And
you mean it was a challenge even before the war? It was
a challenge before war, yes. But when war started, it's still a challenge, I would say. So it's not, we had a lot of meetings with heads of oblast administrations, with city mayors, deputy city mayors, ministers. They asked us about possibility to help them with coordination of different stakeholders and partners. And I would say that as for now, it's very difficult. It's most hard thing. But at the same time, coordination is for HealthRight strengths, and we try to. So we first of all we try to understand clients' needs. We ask our clients. We also would like and try to partner with local authorities. We try to understand gaps where we can be really most effective, most helpful. And also thinking about all these players like international organizations, UN agencies. We just understand that they have another goals, and we try to do our best to meet with them, to understand their goals, their roles, and to try to coordinate our work with them. But at the same time, it's not like it was before war. So if, for example, I know many civil society organizations, they even do not care about coordination now with local state authorities. It's not important. So they just come, they understand here are people who need our help and support, and let's do this. And maybe there will be time. And I know that now donors discuss this issue as what will be next steps, that Ukraine now has this like window of opportunities, window of different resources which come to Ukraine. So let's think about coordination. Maybe in half a year, there will be another probably type of coordination. And speaking about international donors, they actually come to us with good interventions. I would say we try to learn from different our partners like World Vision, known international organization, FHI, UN agencies. For example, WHO, they have great interventions now which are adopted with WHO support to Ukraine, like the same SH Plus or MHGAP. Now it's very popular. We train general practitioners on MHGAP issues. So there are a lot of good interventions which we can use from adopt and with, of course, help of UN agencies, international agencies to Ukrainian realities, and use this as a and use these interventions as some type and in this way we try to coordinate our efforts with these organizations.
It seems to me to some degree,
yes.
This issue around coordination is challenging because, again, when we talk about shifting from a development context to a humanitarian context, the financing, the way the work is financed is actually quite different.
Yes.
The organizations that finance the work are different often, and the emphasis within the grants that we receive is quite different, much shorter term, right? Much greater focus on just making sure that the money gets to the people on the ground. So more of an emphasis on really making sure that you're delivering and meeting the donors' requests,
yes,
and maybe less of a, though there are, I mean, I know that UN agencies in particular, there are sort of cross-sectoral coordination groups in health in different areas.
They try to do this, but there are so many such groups like called UN clusters that we and many organizations like they just don't have resources to participate in all these meetings. Yeah. So on Monday, on Tuesday, every day is meeting of some subgroup. And also we actually learned a lot about this UN cluster system. So usually they establish the system in countries where ministries do not work, for example. But it's not about Ukraine. Our ministries and government and also our state authorities, they continue working starting end of February. So this is quite difficult, to have some international community which attend these everyday different clusters meetings and with no communication with state partners, with no communication with local organizations who finally are those hands who are doing everything in community and in field.
And so as we've been in this for a year now, a little bit over a year, as you reflect on the past year and you look forward and you see how the context has evolved, what would you say, or what to your mind are some of the priorities moving forward in terms of increasing the resilience of the Ukrainian people? What are, specifically within the context of healthcare, like what are some of the priorities that you think need to be addressed moving forward?
Not sure if I understood correctly your question. So
priorities. What should be the priorities moving forward? Both, particularly for folks who are funding this work, and those of us, organizations like HealthRight who are implementing the work.
Yes. So in terms of those who fund our work, I would say that priority should be. So I would say that it's important now to invest in people which are in Ukraine. I mean specialists. So I mentioned in my presentation, so many healthcare workers just left country. Those who spoke in some language, I know that usually they left country. The same is regarding psychologists, social workers. So the biggest challenge now for us, for international organizations, local organizations, is to find people, to find staff. So I think that priority of donors should be to invest in people. We have to train those who are young, who want to stay, new psychologists with no years of experience, but they are brave. They want to help. They already are doing a lot of voluntary work. So it should be trained. They should be trained. There should be yes, investment in human resources. The same is on middle level of specialists. They also have to be trained, and also top managers. I heard about many leadership programs already developed for those who are leaders of this new civil society organizations, leaders of new voluntary groups. So they are doing a lot, but now it's time also to help them to develop some procedures, to be trained, and etc. And I think that in this case, international knowledge and experience is very important. Even education. So a year ago, people didn't think about starting some education in some university online or offline, etc. But now it's time. So many people would like also to receive this knowledge from best universities abroad, to participate in trainings, and also international experts now, they also are very needed for Ukraine, because with their expertise, even online, many services can be and support can be provided online, so they can help to Ukrainian. So human resources, yes, it's priority.
Great. We've got about 20 minutes left, and so why don't we take an opportunity to see if there are questions from the folks here in the room, or similarly, I don't know, Shanice is moderating the online forum, so maybe we have questions either here or online.
I have a question. I know from your earlier work, you were always working with difficult issues with gender-based violence and sexual health. And now you have this vast expansion of staff and this vast expansion of need. And I'm wondering what, if anything, you've learned about self-care for the staff at all levels, that people are in these environments, both personally and professionally?
Yes, it's a great comment or question. And actually, I also needed to mention this as another type of priority for donors, that it's very important to help specialists to care for themselves, and to have this, to train them on some coping issues, because what we observe after 1 year of war, that there are high level of burnout among those who are in country. They also need support. They need help, psychological counseling, and other issues. So for all our staff in Ukraine, for humanitarian workers, we provide supervisions as organizations. So there are group supervisions. It's easier for teams. But also for some people, in some cases, we are able and provide individual counseling provided by good clinicians, good psychologists. We also try to budget in most of our projects some activities for staff, just like retreats or some meetings, because through all these activities, they also can find resources to continue working. So And it's very hard to plan this in east and south of Ukraine because every day is unsafe. So even we cannot find place where where people can feel safe. But for this, we also involve, for these activities to support our staff, we also involve international psychologists who live abroad, who moved abroad, or some international psychologists, because they can help remotely to our staff. But this is really important issue to help people to cope with different problems. And also would like to mention that gender-based violence and sexual violence are so I just in general talked about numbers, but each case was very, very dramatic. Can you imagine? I remember May, 14 years pregnant girl raped by group in Kyiv region. So as for today, our psychologist, it seems to be second psychologist who continue to support her. So it was May previous year, and now it is March, and still this girl needs she will need years of support. And it's also very hard to psychologists to continue this work because it's specific case. This good psychologist, she didn't have such cases a few years ago. She really don't know, and she also requests us more supervision supports, because we understand that it's also for specialists difficult to work with such cases.
If I could just expand a little bit on what Halyna said too, Lloyd, it's such a good question, and I think it really caused us at an organizational level to think a lot more about how we're caring, for our staff. I think when you run an NGO, I can just speak personally, when you run an NGO, you think it's sort of broad strokes about staff welfare, and you think about things like healthcare and whatever. And having a large number of staff sort of thrust into this humanitarian setting, and specifically even at higher levels in our work regularly with Halyna, I became worried about Halyna. She's managing, working 7 days a week, managing massive expansion of programs. And so we've rolled out we've worked with some other psychologists who've helped us design a Caring for Carers program internally. The focus has been on building up that system within Ukraine, but we're rolling it out to across HealthRight to all of our workers. And so I think it's the sort of silver lining here is it's pushed us. Probably should have thought more deeply about it previously. But it's really sort of forced us to sort of think about our staff in a new way, and making sure that we are looking after them so that they're able to look after the folks that we're focused on.
Yes, and also I would like to add, because we discussed this issue with our staff, that many experience and knowledge which we received in Ukraine can be used in other humanitarian and disaster settings. We often think, for example, about people who live in Turkey, because there was a wave. So yes. So can you imagine? It's also uncertainty. We don't know. Maybe there will be another type, and then other people will die, and others. So people feel uncertainties. People, as far as we know, they continue to live in some places like IDP camps in Ukraine. And there are also specialists who help them. But as long as this uncertainty will be, because no one knows when this situation will be another time, those specialists also will need support. And what is recipe to be flexible, I would say, to be adaptable to situation, to look at current situation, to look at situation, to analyze and to define ways how you can help to these people and how you can help to your staff. So there are very similarities between even Ukraine and Turkey, and I assume that there can be such similarities with other countries. We conducted some meetings led by OSCE with organizations from Bosnia and Herzegovina. So 20 years in Bosnia and Herzegovina, or 30 years, it was completely the same than now we have in Ukraine. Afghanistan, there are also a lot of similarities in terms of what humanitarian organizations can do, what civil society and international organizations can do, and what can be a next step in 1 year, 2 years, 3 years.
I think part of the challenge too is making sure that there are resources available to do that kind of work. I think one of the reasons that it doesn't happen the way it should is that, you know, the systems of humanitarian response are not adequately oriented to caring for the carers. And so I think we've internally as an organization, we've certainly learned that being sort of thrust into this new context. And so hopefully, again, like donors will also think about this as a component of humanitarian and frankly, development response, right? We do development work also in very difficult contexts, even though it's the nature of the work is not as acute. We're still working with, you know, vulnerable communities and very difficult circumstances. And so, you know, this is something that we're thinking an awful lot about. There are other questions, Joe.
Yeah, thank you. First of all, congratulations on your accomplishments. It's breathtaking, really. So, and I think the human aspects of what you've talked about are really, really important. But sort of as a policy person, Peter opened the door with the questions that he asked you initially. And having been an organization established in Ukraine for many years and having a track record and a reputation and relationships with government and arguably with other organizations, I think the transition you described into taking on the humanitarian response piece is really interesting. But I'm sort of interested in the policy questions that are raised, because you have raised issues that have been in the literature for years: the lack of coordination of donors, lack of coordination of people on the ground, et cetera. But you have a sort of unique window. I know it's not a momentary, but you're asking for longer term reflection. You're in such a unique position to not only position established, you know, nonprofit organizations to be able to respond as you described, but also this question of the other direction, the capacity building commitment that you had before the emergency, to try to build that into the humanitarian response, which has a lot of implications. So I wanted to just push both of you a little bit to talk a little bit about that. I know it's not a tomorrow thing. You have many more things on your plate, but this question of you have that learning in the country relative to capacity building, training, staff development, staff support. And when the humanitarian, they just come in and they leave and it's gone. And so I'm interested to how you think that could work. I know you'll figure it out for yourselves, but for others.
I can answer at probably a higher level, and then I'm sure Halyna can add some more detail. I would say a couple of things. I think the first thing is that our longstanding presence in Ukraine really enabled us to pivot as quickly as we did. And I think it's remarkable how quickly, yes, and obviously to the talent of the staff and the leadership, of course, but I think that's one thing. I think the other thing is, and Halyna can talk a little bit more about this, is that actually when you look at our humanitarian work, it draws directly from the development work that we've been doing for the last, you know, nearly 20 years in Ukraine. And so actually, even though the focus in the humanitarian context is really on immediate results and getting resources to the people in need, doing that in a way that is not ephemeral, that is actually also with a view to sustainability, which is not part of the humanitarian. It was, frankly, as somebody who's worked and had a career in development, to speak to donors about these grants and to have sustainability absolutely nowhere in the conversation was actually shocking. And so I think, and Halyna can talk, you know, if you talk about, Halyna mentioned the 78 mobile teams, we sort of piloted this model in 2015, almost 10 years ago, and have been developing it. So we pivoted on that model and elaborated on that model. So that's just one example of the way in which we were sort of able to take the development work and sort of adapt it to the humanitarian context.
How do you spread that to others? I mean, that's the other piece.
Yes, yes, great answer, Peter. Yes, I would like to add that. So, for example, last year in June, July, we were not able even to think about any sustainability and about any strategy. So when I remember when in March, UNICEF told me, let's develop budget for 12 months. I told them, no, I will not take money for 12 months. Let's develop budget for 6 months. I was unsure what will be in 6 months. But June, July, we were not able to plan strategically. We didn't think about, so it was like 6 months, maybe 8 months, and then we'll see. So if we survive, maybe there will be another, I don't know, opportunity like this. But now we can think, now we can think about some strategies, and some of donors started discussions about sustainability. And but also when we look at needs of those with whom we work, when we saw all these IDP camps and millions of people who continue to live in these camps, millions of people who will not return immediately to their homes. So it's like this displacement really influenced us a lot. We understand that maybe as a strategy, we can start discussion with donors that today you have to find money to invest for 2 years in this, and this. And we can think about sustainability, which we can implement in 2 years, but not even 2024. So it's not so 2025, probably. We can do some, we can develop some policy changes. We can think how to be more closer to European standards. We need to continue reforms, which we started and then stopped, and then there were some ideas how to continue, but no one actually, it was COVID-19 time. Let's also remind about this. So many reforms also stopped during COVID-19. So now as a strategy, we can discuss maybe in 2 years, development, sustainability, but during these 2 years, we have to prepare our society to implement reforms, to develop some policy changes, and etc. Because we see, so Ukraine, it's very interesting. We started reform of health system, but we didn't start reform of social sphere at all. So we have social sphere like in Soviet Union, like in Frunzensky Rayon on St. Petersburg, which I visited maybe 20 years ago. So all social services belong to state authorities, to local state authorities. And what we see now, we see thousands of civil society organizations that provide these services and provide effectively. They care about clients, they respond is quick, and etc. So it's time actually to think about this reform of social sphere, and we feel that state also trust to civil society organizations, and think that we will help them with advocacy, development of documents, and etc. But returning to question about role of international organizations, now they are also their messages are clear that they do not want to stay in Ukraine. So many already told us this. They would like to identify some local partners, even international, who have presence in country, and maybe transit to them some of their resources, knowledge, again, invest in people, and etc. Because so many cars was bought, so many premises, so many different other items. So of course, offices. So in Kiev, it's not easy to find space to rent office, because the international organizations, there are a lot of organizations there. So next step will be investment in local organizations, probably.
Well, one further quick comment on the policy space is, I mean, I think because of our long-standing work there and all of the relationships, all the wonderful relationships that Halyna has cultivated along with her leadership team over the years, you know, we're in regular time. I'm going to Ukraine on Monday, and I'll be meeting with the Ministry of Health and the First Lady's office, and so we also have this ability because we're on the ground, and because we have that relationship, and because we're also, by the way, seconding staff to the ministry who also, speaking of human resources, need help. we're able to also sort of engage in sort of that policy dialogue. And a lot of our focus actually in that dialogue has been around developing mental health services, because it's such a gap, and it was a massive gap before the war, and it's just that gap has been exacerbated by the war. And so we're certainly cognizant also of the opportunity to sort of engage in that dialogue and make sure that community level voices are heard and influence the policy process. We're able to sort of be that conduit in a way. I think there's a question online as well.
Yeah, we actually have a couple questions online. So I'll just throw them all at you now if you want to cover them throughout. So the first one is, can you talk a bit about how you go about coordinating your work with the healthcare delivery system? The second is, can you speak a little bit more about the new mental health and psychosocial support models that you've mentioned? And the final is, how does the war affect the diaspora? I'm so sorry I said that. And those were it.
So the third one is about role of diaspora and how we work with them. So maybe I will.
Or how it affects them, yeah.
Yeah. So I would like to emphasize that we are very, very grateful to all support which we receive from international community, from US citizens, US government, and also from diaspora. So of course they help a lot to Ukraine and Ukrainians. There are a lot of also European donors who support us, but the biggest money come to us from US. It's true. So from US government, USAID, BHA, and other donors, and also even citizens, normal citizens. So, and diaspora also helps us a lot. Not to HealthRight for health. For example, on Friday, we are organizing, and it will be part of CSW 67 event focused on women. We are organizing with one of diaspora's organizations here, Ukrainian women here in the US, one of events focused on mental health of Ukrainian women. So it's very important because and it will be joint event with one of the diaspora's organizations. Also, we conduct some presentations for them time to time in order to inform them how they can be helpful, how they can help to Ukrainian. About interventions, so mental health interventions. So now I mentioned already about developed by WHO and First Lady Office framework focused on mental health reform. So part of this framework, there are a few interventions which are part of this framework, MHGAP, trainings for, this means trainings for general practitioners, how to screen, identify, and refer clients with different mental health disease. And we signed an agreement with WHO and Ministry of Health. So we have our own trainers and can do MHGAP trainings. And we are doing this. So we already trained maybe 150 general practitioners on this. Also a self-help plus, PM plus. And this is great that HealthRight already piloted these interventions in Uganda, in Africa. So we have also these records, and also have our own trainers. We will continue these trainings also in Ukraine for social workers, psychologists, and other not health providers. Yes, and
so these are, let me just, very briefly, these are a number of these interventions, which Halyna mentioned, self-help plus, problem management plus. These are a group of interventions that were developed for low resource settings that don't require trained mental health professionals, so that you can scale them quite easily and it keeps the cost down. You can also do them in group settings often, or they're self-guided. So these are very scalable. They've been shown to be very effective. They can be deployed quickly, and they're also not specific to any sort of mental health condition.
Yes.
They're generally effective against anxiety, depression, PTSD, et cetera, which we see most commonly in conflict settings like this. And so they're particularly appropriate. And I would just say that in addition to those interventions, we're also working with colleagues here at NYU to adapt those interventions. So Self-Help Plus is designed to be a 5-week intervention. For IDPs, that may be a little bit too long. So we're looking at condensing it to 2 or 2.5 weeks to see if it's still effective. We're also looking at, we're working with PT Lay, who actually just walked out, to adapt it, to put it online and have it as a mobile app, and also to use it as booster sessions. So once you've done the session, you have a mobile app and you can re-engage with the material on your own, wherever you are. And so we're looking at adaptations like that through our work as well. So really trying to adapt some of these tools that we've been using within HealthRight for many years to this new context.
Yes, and the first question was about
The first.
Coordination, I think.
coordination of health.
Yeah,
Of
which
the
we talked a
healthcare
little bit
delivery
about.
system.
Yes, it's actually covers this question. Just to add that we do not bring health supplies, some medicines to Ukraine, but at the same time we collaborate very closely with AFIA Foundation, which provide us a lot of medical equipment, provided already medical equipment, some hygienic kits, and we are very grateful for AFIA Foundation and distributed them broadly in Ukraine among our clients.
So we've become a logistic, in addition to everything else, we've become a logistics organization.
Yes.
I think we're right at time actually here. So with that, Halyna, thanks as always for coming to share your sort of firsthand perspective about the experience in Ukraine. It's very important, and I know people here are really interested in hearing more about it. And so thank you for taking the time to do this. Thanks to all of you for joining us today, and thanks to all of you online as well. And have a great day. Follow us on social media. We have Twitter, Instagram, although the Twitter platform seems pretty fragile these days. Facebook, etc., LinkedIn for updates. The Ukraine team is actually really, in addition to everything they're doing, the social media work is really amazing. And they're very good about communicating the work and the impact. So follow us there.
Thank you.
Thank you.
That's why.